Hello everyone, I am Dr. Anchal Makhija and welcome to our first podcast, Transplant Journeys. Isn't it a auspicious day today as the portal 777 has opened? Isn't it? Yes. So, I believe that we all have a common goal which is healthy living. But to achieve that common goal, we all have different journeys and unique journeys. So, my mentor, Daisaku Ikeda, has once said that getting sick or ill is extremely painful. It is, no? But it gives us a chance to rediscover our life and faith. So, today we have our first guest with us who has rediscovered his life, Mr. Thomas Dodds. He is a Canadian living in USA. He battled this disease for more than 39 years and he got his liver transplant 10 almost 10 years back. So I welcome you Mr. Thomas on our podcast. So how are you feeling today?
And thank you for having me on your podcast and being your first guest. Very, 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 very happy to be here.
Thank you so much for coming and showing up today. So, Mr. Thomas, please tell us little about yourself and tell us, at which year, at which age that rare disease of liver have been diagnosed, and at which year you got your transplant done.
Yeah, I'm almost 50. I'm a professional. I work in the data management area. I'm a consultant. But when it comes to my knowledge of liver disease, I was diagnosed with a rare liver disease called alpha 1 antitrypsin deficiency at birth in 1974. And I lived with onset of liver disease, and it progressed till I was almost 39 years old when I had a transplant in 2012. And that transplant was a living donor transplant. So as we go, you'll learn more about that.
That must be hard for you. So, can you please tell us that how was the diagnosis happened and what did you feel, how what did you feel about receiving that news and what happened at that moment exactly? Do you remember those crucial moments?
Well, most people who end up with a liver transplant usually either get them nowadays as infants or young children, if they have a birth defect, let's call it that for now, or they receive a devastating diagnosis later in life and need a transplant under an urgent set of circumstances. I'm old enough that I don't fit into either of those categories. I was diagnosed at birth. Therefore, I've always known that I was a liver patient. That has had an effect on me as I live. I've had to make choices that are, you might say, liver smart, liver healthy, and going through life with always that as you might say, something in the front for my for part of my mind, has produced a different life for me than normal. Um, not a hard life per se, but a different life.
I agree to that. I agree. Definitely, it's very difficult to accept and cope up. So, can you tell us a little more about what this rare disease is? And you already mentioned that it happens in children these days. So, what is this disease, and how it happens?
Alpha 1 antitrypsin deficiency is a genetic condition, so you need two parents, each giving a bad gene to the child. What that gene does is genes are the instructions for how our cells work. The liver cell produces a protein, and the people who have the two bad genes, if I'm going to be really simple about it, the people who have the two bad genes end up with alpha 1 producing a badly formed protein. Now, there are some people who don't produce enough of the good protein and they end up with lung issues like emphysema, COPD, things like that.
Okay.
There are other people who produce too much of the bad protein And because the protein is malformed, it doesn't slide past the other one beside it, you might say, in production. And so they get all tangled up, make knots, and take over liver cells, thus killing the cell. A dead liver cell turns into scar tissue, and we know that as cirrhosis. So, for 39 years, give or take, I was producing enough of the good protein to keep my lungs going. I don't have any lung issues, but I produced too much of the bad protein and it slowly took over my liver.
Right, right, right. So it is a balance between a good and a bad protein.
Yeah.
Thomas, please tell us that, what kept you going for almost 39 years before getting a transplant? And, what were your beliefs that holded you at that time, at such big time?
Yeah, it's a good question. How do you deal with, you might say, your mortality from a very young age?
Yes.
I can recall going to many doctors and them saying, "Well, we don't know." That's not a great thing to hear when you're 5, 6, 7 years old, and you can remember it. And then, as I got older and medical technology started to advance, I would hear things like, well, we hope he lives long enough for transplant. Um, so, how do you live? How do you live like that? Well, I was adopted because of my liver disease, largely. I was adopted into a Christian family. So there was a deep belief in God, a deep faith. And there was always the sense that something greater was at work. If I transfer or kind of traverse back in my life, I end up seeing events in my life and things in my life that don't add up statistically. And I don't believe they are by chance. I think they are in an ordering
True.
such that it's producing a person who is uniquely, you might say, uniquely equipped to share a story like this, to provide hope to other people, to give a sense that we're not just here by random chance. I
Yes.
don't believe in chance, and if I did, I'd buy you a lotto ticket. So really, when it comes down to it, it's a case of faith, a case of believing that God is there, He knows, He cares, and then living your life to that, seeking a purpose, knowing that there is a purpose, seeking it out, and then once having a good grasp of it is to live it, and that's what I try to do. So did I have that all the way through, even as a child? No. When I look back, I can see where I kind of doubted it. I was in the fog. I was this. I was that. But looking back over it now, I can see how those things are stitched together, and it produces a story that I have.
Yes, I totally believe you, and I totally, agree to that. That faith is something which keeps us holding. To this, I also want to share, Thomas, that I was also going through such a period of my time where I was on dialysis for almost 5 years, and I have applied for transplants again and again, again and again. I went there, I got the call, it did not happen. For some moments I feel shattered, but then again faith kept me going because I had a belief that something big is coming up, and indeed it happened. On my birthday this year, this transplant happened, in May. So I totally agree with you. What keeps us going is our faith, our belief in, in any power you believe in. It can be, Jesus, it can be Buddha, it can be anyone. So thank you so much for sharing this. So now, After this, I want to ask you that, what were your high points at this moment, and what were your lowest points of those years?
That's an interesting question too, because we tend to like to talk about the high points, but there are low points. I don't look back at my life and think it was terrible. No. Was it smooth sailing the whole time? No. Because there's glory in it, there's also grit. Because there's joy in it, there's also pain. High points or glory and joy points, maybe. Making it to age 5. I have a picture where I'm standing with my little bag and I'm heading off to school for the very first time. I wasn't supposed to live that long, and most kids get a picture as they're heading off to school, and it's just it's the accomplishment of going to school. Mine's the accomplishment of surviving and going to school. That's a big one. Going off to university, pursuing higher education. I have the better
Okay.
part of 4 degrees, which in a, you might say, a career liver patient, um, there's a lot of room for toxicity, which produces a lot of mental issues, cognitive issues. I didn't get any of that. I think that's a high point, that I was spared, even the hepatic encephalopathy and things like that, even though I had had liver disease far longer than anybody I had ever known. Um, High points. I did get married, have
Cool.
children.
Nice.
They do have alpha one from the perspective that they have a bad gene from me and a good one from their mother. So humorously, I used to ask them why they were misbehaving, and they say, "Well, we got the bad gene from you, Dad." So, um, high point is children. Children's a high point. The fact is that they're healthy today is a high point. Um, and as I look most recently, I'm embarking on writing my story as a book. Um, and to be now, 10 and a half years out of transplant, to be as healthy as I am, because transplant's not a cure. A lot of people think it is, but it's not. You're trading one set of medical circumstances for another. Every day is an adjustment. You, as a transplant recipient, know that. And
Yes.
most people look at us who are doing well, and they're like, "Oh, you're cured." No, we're not cured. We've learned to overcome one set of circumstances by trading it for another. Low points. Um, Low points is where my liver decompensated. I can remember getting a call from the doctors noting that I had diabetes. Most of the people I knew that had diabetes were old. At the time, I was maybe 30 or so. Um, and 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 honestly, as I was driving down the road in a Jeep, and I had the top down, and it was sunny out, and I can recall this vividly, and I'm crying like a little kid, because it was devastating to me. I had kind of pushed my liver condition so far down, and was
Right.
living life, and living large, only to find out that I had this. So that produced, almost like a mini depression. Now I've been a diabetic now for close to 20 years after that. And I've, got it under control, but again, every day's an adjustment. So what do, right? You learn to adjust and you roll with it. So a low point turns into a high point. Another one is, end up with, the lack of fluid transfer, because the liver is basically turning to concrete through cirrhosis. So I start putting on what they call ascites. I'm starting to build up plasma in my abdomen, and I'm having to go and get that tapped, drained off every couple weeks, and they're taking off 11 to 13 liters of fluid So think 24 to 26 pounds of fluid building up in your body over a matter of weeks. And it gets hard to breathe. It gets hard to move. You're cold all the time. You get to the point where you're very aware that this doesn't end well. There's no good outcome. You don't overcome this. You're in
Right.
end stage liver disease, is what they call it, right? And so I found that very difficult, um, especially because my children were young at the time. So I have, you know, very little memory of being able to run around with the kids, um, because of that fact. So it's a low point. The other one is I was having my ascites tapped one time, and I noticed because I studied what was happening to me. I was very involved, and I would encourage anybody who has a chronic illness like this, who is, maybe pre-transplant, you want to pay attention as much as you can, because I picked up my bag of fluid and I figured out that I could walk the hallways, a brisk walk, and I would drain my fluid a lot faster than the other patients around me who were getting tapped. Well, as I walked, I noticed a swirl in one of my bags, and I stopped the nurse and asked her about it. And she said, "No, no, don't worry about it. Sometimes you get a little albumin, you'll be fine. No big deal." Well, I happened to see a doctor in the hallway, and I stopped and asked him. He told me to go straight back to my room. What I had discovered in my own fluid was very, very early stages of spontaneous bacterial peritonitis. It's an extremely painful condition if let bloom. So again, a low point turns into a high point. The low point is I'm told I have about a year to live. I'm told that I need a transplant at that point. I ask how long the waiting list is, and they say, well, it's 3.5 years in the area that we're in. Well, I can do the math, and I figure out 3.5 years is a lot longer than 12 months. It's a low point. You, there's an end to this, and you've arrived at the final descent, you might say. So that those are the big low points for me, and you'll notice that I did not mention transplant itself as a low point, because it's not. It's not. It could have been, but it's not.
I totally, feeling so overwhelmed, as well as, when you have beautifully said, turning your low points into high points. And, this is something only I think people, they want to do it, but sometimes they give up, they can't do it. So, of course, they will be inspired from your journey, and they definitely will make their low point into the high point. So, in the last question, we will leave a suspense on what happened post transplant in the life of Thomas Dodds. So, for that, you have to stay tuned for our second episode. So, Thomas, thank you so much for sharing your life beautifully of your those 39 years into our podcast. And I'm so excited for your journey post transplant. So, how are you feeling?
Thank you for having me on this inaugural episode. I feel very honored, and yeah, I can't wait to continue unfolding my story for you. And as someone who is 10 years out of transplant, I've walked this road, and I can speak to it fairly confidently, even though a kidney recipient and a liver recipient are very different life. There is a lot of commonality, especially uh, for us transplant people, and that includes you cardiac and lung ones too.
Thank you so much. It was the pleasure was all ours for to hear your story and feel it, actually feel it. So thank you so much once again, and stay tuned everyone for his journey post transplant.